My name is Mathieu, and I'm a general pediatrician in the Department of Pediatrics at the University of Virginia. My area of study is the youth and adolescent mental health crisis. We know that prior to the COVID pandemic, children were really struggling with mental health, but in the past 2 years, things have only gotten worse. I saw this firsthand as a pediatrician in my clinic, where kids with a variety of mental health issues started coming in even more frequently than pre-COVID levels. And I was really disturbed by these cases that I would think about after work. Kids struggling with eating disorders, with mood issues like anxiety and depression, and even thoughts of self-harm. I'm motivated by the opportunity to make a difference on a systemic level. It's meaningful and important to see patients in my clinic one-on-one, and I'll continue to do that as an iTHRIV scholar for 1 session per week in my clinic. But I really wanted to think about ways that we can change systems and communities to really make sure that all kids have access to mental health and to also take a preventive angle. I think one of the great things about being a pediatrician is that we are so focused on prevention. We give vaccines during checkups, we ask about routine developmental progress, and like that, I think we have an opportunity as researchers to figure out ways to prevent some of these major health issues, like mental health challenges, from becoming severe and stopping them before they really get out of hand. Mentorship means building a team of people who have similar life experiences but are further along in their careers than I am. And I've really benefited from some fantastic mentors in the past few years. Starting back in medical school, my very first research mentor was the person who got me excited about this work. She was a general pediatrician, and she is a leader at her institution, but she also is a leader in the field of pediatric research. And it was through her that I saw the opportunity to not only be a frontline general pediatrician, but also to get to know the community where I was working, really understand the major health problems facing the children I was seeing, and then leverage the resources of a university to create new knowledge in order to tackle those problems at the root. So mentorship means learning from people like that, and it also means giving back and recognizing that as a budding researcher myself, I can serve as a mentor to medical students, undergraduate students, and those even earlier in their training who may not even know what it means to be a pediatrician and a researcher. I'm really excited to meet my fellow iTHRIV scholars, to spend more dedicated one-on-one time with my team of mentors, and to meet the other mentors in the program. I think one of the great things about this program is that it creates a community across institutions, and we can learn from each other as we're embarking on our projects, as different as they may seem. And I think the most exciting thing, though, is just protected time and really having that dedicated time and space to think about my research questions and to focus on the solutions to these systemic problems that when you're spending the most of your time as a clinician, you don't really have the time and space to do. And it's a huge privilege to be able to think about some of these issues and tackle them in a broader way. And so I'm really excited to have that time and to have the resources dedicated to be able to do this.